I'm not sure that the budget workshop is where we need to be talking about this. We made a decision about going with our being the job that we have as far as county commissioners, as far as development is concerned. We have reached out and said that we would, and like you said, we have a seat at the table, and my understanding that this group is also reaching out to each one of our municipalities for them to make a contribution based on their population, from the smallest to the largest. That may be erroneous too. I've just heard that, but
that goes back to when we were sitting in the meetings. They were talking about $1 a person.
Right, but that is what they are doing. We have reached out, talked to them about being collaborative, just like you said, Tom, and I think this needs to kind of be put over here. We don't need to make a decision on anything right now until, we hear more and go to a meeting and get our person. My understanding is we've got some good applicants, excellent applicants, in fact. I've seen some of the names, I've seen a couple of the resumes, and so I think we're going to have a good person in here to lead us. I feel like we will, and I would not want to make a decision for the commissioners to make a decision based on this without that person in place.
Chairperson, I would like to ask that maybe we follow up to see if we can know what the subscription levels are going to be. Just to be clear, because we do want to make that differentiation that in any investment that would be separate from the county would not be the Pitt County Development Commission's investment, which would be, decision made by that board that's autonomous from this board.
I suspect that $200,000 though is based on the population of Pitt County with
Yes.
students.
Probably
That
what
comes
it
out
is.
to
That's what it
roughly
is.
200,000.
That's what you talk about that. That's what I'm thinking too.
Yeah.
Okay, so is it okay if we move away from this and get back on our job today? Thank you. Anything else?
That's it.
Okay, if you have anything else, it's okay, Scott. Thank you for bringing the stuff back from the sheriff for us to.
I do have a question, though.
forward.
Something that Brian said yesterday that's relevant. You said that you wanted to take the development monies and break it out separate, just like fire taxes in the county. Now, you proposed a 72.9% tax rate. Does that include the development, or is the development going to be a separate penny out here?
Actually, that 72.9 includes the penny you're talking about.
Okay,
before.
all right. Just clarity.
But
That's all I
what
want.
we're trying to do on the tax bill, though, is break it out at 71.9 general fund, a penny for industrial development. So thus the net effect is 72.9, like you just said.
Okay.
Okay, and I meant to acknowledge at the beginning that Commissioner Fitzpatrick and Albright are not here today. Commissioner Albright Fitzpatrick is going to try to get back if he can before we're over, but I just wanted to acknowledge that they had been excused. And can we move on?
Yes,
Are we
ma'am.
ready? Public health, Amy Tatum, if you would come forward.
Well, good morning. I'm Amy Haddam. I'm the interim public health director, and my normal role is health education director and public information officer for public health, but I'll be doing the interim role for a few more weeks now. I guess you saw the news yesterday that we have hired a new public health director. Dr. John Silvernell will start with us on July the 1st. Marcia Hall is our budget officer, and together we've prepared this presentation. And since many of you are new to the Board of Commissioners, we felt like we needed to give you an overview of our services so you can understand why some of our requests that we're making to continue our services. Many people in the community say that public health is one of the best kept public secrets in the county, and we certainly agree with them. We also wanted to point out that we are an accredited local health department. Just a few weeks ago in March, we were reaccredited by the North Carolina Local Health Department Accreditation Board. We were reaccredited with honors, meaning that we did meet all 147 of the required activities. We were very proud of that. And actually tomorrow we do go before the State Accreditation Board to make it final and to receive our plaque that will be displayed in our agency for our clientele to see. We are governed by an 11-member Board of Health. Dr. Keith Ramsey is our physician and our chair. Dr. Mark Hayes, our veterinarian, our vice chair. Commissioner Colson, Tom Colson, represents this board. Dr. Lady Aycock, our optometrist. Tina Dixon, an at-large member. Rex Fleming, an at-large member. Nitesh Patidar is our pharmacist. Porter Stokes, at-large. Dr. Martha Engelkey is our nurse representative. Dr. Adam Harrell, our dentist, and Lowell Spate, our engineer. Our mission: to protect, promote, and assure the health of all people in Pitt County. And we do this, we protect people from unnecessary environmental risks such as exposure to lead, foodborne diseases, waterborne diseases, and other communicable diseases. We promote individual and community health behaviors which increase the span of a healthy life. We assure access to essential preventive health services for all people. And we are first responders. All Pitt County Health Department staff members, regardless of our discipline, we are first responders, and we're required to work during times of emergency and natural disaster to ensure that we're protecting the population health of the county. So our agency is directed by a dual role, health director and medical director, who is a physician, and serves under the direction of the Board of Health. And we have 5 managers who oversee the work of public health, and these divisions include environmental health, personal health, administration, health education, and nutrition. And we have over 130 positions that make up our staff, numerous disciplines, and these disciplines, of course, a physician, we have nurses, nurse practitioners, nurse midwives, social workers, health educators, nutritionists, outreach workers, lab technicians, administrative clerical staff. We do have a dentist now, and dental clerical staff, as well as our environmental health specialist. So a few of the services that we offer that these disciplines provide. Services for children. We do a lot of home visits, newborn assessments in the home, well child checkups, childhood immunizations. We also operate the Women, Infant, and Children program, nutrition services to ensure our children are getting adequate nutrition. We provide care coordination for children up to age 5, lead screening up to age 6, sickle cell testing and counseling, and dental care for children in our mobile dental unit, Smile Safari, which moves around from school to school, and you'll hear a little bit more about that in a little bit. We also offer services for women, and some of these are for men too, but primarily for women. Pregnancy testing, our prenatal clinic offers outreach and support as well, childbirth education. I hope you've all heard of Triple P Positive Parenting with all the numerous billboards we have around the county that a grant pays for that. That is a great program that we've had for a few years. Again, the WIC program, breastfeeding education and support, family planning, including birth control methods, and breast and cervical cancer screening. General services for adults, cholesterol, diabetes, and blood pressure screenings, immunizations, TB testing and follow-up. A huge one, sexually transmitted diseases testing and treatment, and communicable disease control. And service eligibility for these services, our fees for these services are based on income and family size. So a person's ability to pay would be according to what their fee would be. We also offer environmental health services. Many people in the county do not realize that environmental health services falls under the public health umbrella. They're one of our divisions. And our public health, environmental health specialists, they inspect public food establishments, child care centers, schools, the hospital. They also evaluate soil for suitability on on-site wastewater systems, inspect public swimming pools, which is getting ready to be a busy time for them right now. And they provide surveillance and control of mosquitoes, which is also going to soon be another busy time. There again, we do provide community education, presentation, consultation, program development, flu shots, and other immunizations in the community. Any way that we can reach out to the community to protect the population's health. A lot of people also do not realize that the health director is the local registrar for all birth and death certificates occurring in Pitt County. There are over 3,000 births and over 2,400 deaths that occur annually in Pitt County that are processed through our agency. And approximately 2,000 of these births and 1,300 of these deaths are Pitt County residents. So funding that supports public health programs. For fiscal year 18-19, our revenue for $11,796,907. And as of March 31st, when Marcia was preparing to submit our budget estimates, our revenue at that point that we collected was $7,998,060. So our expenses as of March 31st were $7,949,928. So at that time, our revenue were greater than our expenses by $48,762. So we were glad to see that. Our proposed budget for fiscal year 19-20, it is an increased amount. We are asking for $12,011,767. But do note that $74,882 of this amount is required by the auditors for payroll accrual. I know Brian can speak more to that if you have questions about that. So a breakdown of our revenues for 2020. 27% of our revenue is state and federal at $3,187,823. We are asking for the county appropriation of a little over $6 million, which would be 50% of our budget. Fees and charges, $1,571,742, 13% of the budget. And then our fund balance at 6%, which is $734,501. And then miscellaneous revenue at 4%, which would be $438,529. And the way our proposed expenditures are broken down, 77% of this budget is salary and fringe, $9,217,284. Operating would be 23% at $2,719,601, and that's comprises the $11,936,885. But then again, that additional $74,882 is what brings it to the $12 million. So grant-funded programs, over $4 million currently in grants are brought into Pitt County from national, state, and local funders. In addition to state and federal grants, we also receive grants from Vidant Medical Center Foundation, the Martin Pitt Partnership for Children, better known as Smart Start, United Way, Blue Cross Blue Shield, the Duke Endowment, Kate B. Reynolds, and local service clubs like Kiwanis or Rotary for various purposes. In addition, we house regional public health programs that serve Pitt and our neighbor counties. We get several grants from the state that ask us to be the hub for that money, and we serve our neighboring counties. And because of our strong management team, we're able to leverage our existing infrastructure to obtain and administer a wide array of grants that are provided to the citizens of Pitt County and beyond. And we also pass a lot of grant funds to other entities. With your permission, of course, we always bring that by you before we do that. This past year, we did send or pass $250,000 to Vidant Medical Center so that they could operate with their school nurse program 5 additional school nurses in addition to those that they already fund. We also passed $100,000 to Vidant for the Active Routes to Schools campaign because they already have an infrastructure to implement that program. And then we passed funds to organizations like Picasso, the Pitt County Coalition on Substance Abuse, and then a local needle exchange program. And there again, we do not pass those funds without that permission from this board first. So this brings us to the justification for our additional requests for 2020. I do want to preface this by saying that our work is driven by the needs of the community, and as a requirement of the Department of Health and Human Services, we partner with our local hospital to conduct a community health needs assessment which examines the health status of the county, and it provides a focus for us to address the highest health needs of the county. So once that needs assessment is completed, we do that every 3 years, we bring the findings from that back to our Board of Health so that they can select priority areas for to focus on for a 3 to 4 year period. So in February of 2019, our management team participated in a strategic planning session with our Board of Health. And the community health needs assessment was shared with board members. Upon reviewing the data from that, the Board of Health decided to focus on 4 priority areas for the next 3 years. The largest one, or the one with the most focus that I'm going to talk about in a minute, is infant mortality prevention, followed by chronic disease prevention and control, risk factor reduction, including physical activity, nutrition, substance abuse, including tobacco, and then sexually transmitted disease prevention and control. So the top health priority selected by the board for the next 3 years, again, was infant mortality, and that is defined as the death of a baby who's born alive but dies before reaching his or her first birthday. So looking at this graph, let me explain what this will explain to you. The reason the Board of Health selected this health priority is due to the high infant death rate in Pitt County. Our infant death rate remains higher than the state's rate. This graph represents the disparity between the white non-Hispanic, which you see the bars on your left, and the African American non-Hispanic infant mortality rate. As you see, the white rate did reflect in the left bars that it had begun to slowly climb beginning in 2010, but it began to decrease again between 2013 to 17. And although the African American rate continues to be 2 to 3 times the white rate in our county, the 5-year average between years 17 and 18 does reflect a decline in the rate among our African American population. So over the past 30 plus years, we've implemented many interventions that have helped to reduce the infant mortality rate in our county. However, recent cut to grant funds are now endangering the level that we can continue to address infant mortality in the community. This scares us a little bit because we can't let our guard down and stop supporting programs that are saving our babies in our county, because infant mortality is an indicator of the overall health of our population. So that leads to our first ask. To continue to address infant mortality, we are requesting 2 full-time equivalent infant and postpartum home visiting nurses to provide in-home assessments to low-income mothers and babies who are either at high risk for having an infant death or who are Medicaid recipients. And the rationale behind this: women who receive home visits are more likely to have better all-over health, more likely to breastfeed, which is the best form of infant nutrition, are more likely to have better newborn parenting skills, more likely to receive help for postpartum depression, and their infants are more likely to enter care with a pediatrician to receive well child care and immunizations. And then the home visit also provides the opportunity for the nurse to conduct an environmental assessment of the home, the environment there, to identify any concerns and any safety issues. And I also need to share that nearly 60% of Pitt County births are to mothers who are Medicaid recipients. This equals over 1,000 babies that we could be reaching out to. But currently we have 2 temporary part-time nurses who are providing the service. However, they're retirees. They may not continue to work with us for much longer because they don't have to. In addition to them being part-time, they can't. The reason that they're part-time, they're not able to provide services to all of the babies and moms that would need it. So by employing those 2 new full-time nurses, we would be able to serve a larger population in need and also help improve the health of both mother and baby. The personnel cost for these 2 nurses is $135,948. But I do need to remind you, these are revenue generating positions, meaning we can bill for these home visits and get a reimbursement back of $120 per home visit. So in time, it would pay for itself for both of these positions. So that was our ask for funding those 2 positions. We also had another ask. We're also asking for $80,270 to sustain 2.8 full-time outreach workers who have been working to provide services to high-risk pregnant and postpartum women by addressing the social determinants of health. Food, housing, transportation, jobs, other forms of support, which are all contributing factors to poor birth outcomes and infant death. These two outreach workers have been extensions of our social workers. Our social workers can only provide so much support because of the high caseload that they have. But our social workers identify the mothers who are at the highest risk of having either a poor birth outcome, an infant death, and they are assigned to the outreach workers. So the outreach workers, they're providing the care to the women who need it the most. This program has been very successful for the past 24 years. As the mothers enrolled in the program learn how to care for themselves and their children, how to become self-sufficient, and the babies enrolled in the program have thrived. So we know the program works. But here's our dilemma. This year, when it was time to reapply for funding,